Next, we call upon Dr. Ankita Man.
Good morning everyone. I am Dr. Ankita Man from KGMU, Lucknow. My topic is limbus insertion distance of horizontal recti on anterior segment optical coherence tomography and axial length on A scan and its correlation with comitant horizontal strabismus, a pilot study. What is known, there is a good correlation of limbus insertion distance on ASOCT with the surgical measurements. But what is unclear, correlation of limbus insertion distance with type or severity of deviation or surgical effect of recession on or resection. All previous studies have used intraoperative measurement to determine this correlation. Intraoperative measurements are not in physiological state and have limited accuracy. Hypothesis, limbus insertion distance of horizontal recti measured on SDAS-OCT correlate with the type of deviation in comitant horizontal strabismus. Aim is to measure limbus insertion distance on spectral domain anterior segment OCT and axial length on A scan in patient with comitant tropias and to compare limbus insertion distance and limbus insertion distance to axial length ratio with age-matched controls. Objective are to correlate in patients of esotropia, exotropia and age-matched control the limbus insertion distance for medial rectus and lateral rectus and limbus insertion to axial length ratio. Study setting at Department of Ophthalmology, KGMU, after ethical approval. Study duration 3 months. Study design cross-sectional analytical study. Inclusion criteria are patients giving written informed consent, cooperative for ASOCT examination, age more than 6 years. Exclusion criteria is refractive error more than 5 diopter, previous ocular surgery, sensory and vertical strabismus. ASOCT scan was done using ASOCT, Cirrus SDOCT with an anterior segment attachments. Measurements for medial rectus and lateral rectus done. Measure of readings from 3 scans recorded. Muscle insertion to the anterior chamber angle measured using software caliper provided by the device. Axial length measurement will be done with a scan. Sample size, no previous study has been conducted to correlate the measurement on ASOCT with ocular deviation. This was a pilot study and all consecutive samples over a period of 3 months. A total of 29 esotropia, 10 exotropia and 13 control samples were analyzed. Statistical analysis, mean plus minus standard deviation and range of limbus insertion distance was calculated for exotropia, exotropia and controls and compared using unpaired t-test. Limbus insertion distance to axial length ratio was correlate in case and control using unpaired t-test. A p-value of less than 0.05 was considered statistically significant. Results in which mean limbus insertion distance to axial length ratio for medial rectus and lateral rectus found statistically significant. There is no significant, statistically significant difference was found between the mean of limbus insertion distance of horizontal recti in comitant strabismus. However, a statistically significant difference was found in the limbus insertion distance to axial length ratio in case compared to controls. Conclusion, limbus insertion distance to axial length ratio in comitant horizontal strabismus is significantly different from age-matched control. It correlates with the type of strabismus. Thank you.
Just one question. How accurate are you when you do the measurements with the ASOCT? Were they correlated intraoperatively? Did you do any surgery on them? Any patients were operated? Any patients with ESO or exotropia were operated? Because ASOCT it's a little variable when it gives your results. It's not that accurate. So they have to be correlated with your intraop findings before you actually have a study saying that this is the correlation with the axial length.
Yes, sir.
Again, it's not OCT. Basically, the give roughly idea. Otherwise, when you do the squint surgery, this surgeon's own like experience experience of some time when what at what level you are cutting and whatever you are suturing. So this is surgeon associated many factors. Okay. So,